In this brief lecture, I'm going to review neurological exams and common diagnostic tests. As nurses, our role is not to just perform parts of the neurological exam, but also to recognize changes in our patients, support the patients, and provide pre and post-procedure care. A neurological assessment should always be done on admission to provide a baseline. The focus of a neurological assessment is to assess and establish the present function of the patient's neurological system, and therefore we can detect changes from the previous assessments. So a basic neurological assessment is a quick way to identify changes. We always do this on admission, and then if there's any issues, then we'll continue to assess, or any changes in the patient that warrant a neurological assessment, we will continue to assess and do further assessments. So the main components of the basic neurological assessment are level of consciousness, their orientation to person, place, and time, vital signs, pupillary response to light, extremity strength and the movement of your patient. Are they coordinated? Are they unbalanced? Reflexes and sensation. Changes in any of these things can be an early sign of neurological deterioration. So the Glasgow Coma Scale, you've all seen this before, you've all learned it. This is just a brief review that the Glasgow Coma Scale measures the patient's level of consciousness in an objective format on a scale of 1 to 15. It looks at eye opening, it looks at verbal response, and the motor response. The highest score a patient can get is 15, which is normal in all areas, and the lowest a patient can get is a 3, indicating a very deep coma or brain death. Nurses use this score, Glasgow Coma Scale, frequently to monitor and track neurological changes in clients. Abnormal posturing, again, this is a review. You learned about this. When someone has a brain injury that is severe, you may see abnormal posturing in their body. So in figure A, they're localizing to the painful stimulus. In B, they're withdrawing from the painful stimulus by lifting the leg. In C, this is the decorticate posturing, where one or both arms are fully flexed in on the chest. In D, it's decerebrate posturing, and one or both arms are stiffly extended outward. And lastly, in E is absolutely flaccid, no motor response or tone. So again, decorticate, as a reminder, is when the arms are flexed in toward the core. So think decorticate to the core, the arms flex in toward the core, the body, the wrists and fingers all rotate inward. This usually means damage is higher up in the brain, above the brain stem. Decerebrate posturing, which is, I guess I can use this one here, is when the arms extend outward, and think E for extend. There is 1, 2, 3 E's in decerebrate, so think E for extension. The arms and legs are stiffly extended, wrists are flexed, and head may arch back. This is more serious and suggests damage at the brainstem level. The decerebrate posturing. These are both serious signs of major brain damage and should always be reported immediately. And that's just another picture here of the decorticate and the decerebrate posturing for your review. So pupil assessment, this is just a quick review. PERLA stands for pupils, just one second, I'm going to get another color. Pupils are equal, round, reactive to light, and accommodate. Okay, so we check if both pupils are the same size, so pupils are equal. We check and see if they're reactive to light, so if they constrict with light, and we check for accommodation, which is if they adjust for near and far vision. Unequal or sluggish pupils can be a sign of a problem in the brain, such as increased intracranial pressure. Always remember too that you are to look at the size of the pupils before you shine the light in, and to decide if they're 2, 3, 4, 5, 6, 7, 8, 9 millimeters in size. So a little trick is to think that PERLA means perfect pupils. If someone does not have PERLA, then this is an indication that something is wrong. So if they're not equal, if they're not reactive, or they're reacting sluggishly or in an uneven way, or they're not accommodating, then that is telling you something is wrong. For motor function and reflex testing, you're going to assess the size, tone, strength, and coordination of the large muscles. You're going to pay attention for any signs of atrophy and assess opposing muscles for equality of size and strength. So you'll push their palm against your palm. You could get them to pick up a small item, grasp an object firmly, or squeeze your hands. Resist removal of an object. You can check hand grips, and you can check deep tendon reflexes. So in addition to general strength testing, we can assess coordination, muscle tone, and you can assess deep tendon reflexes. And so some of the signs you learned about were the Kernick sign. So Kernicks and Brodzinski's, if you remember, are both signs for meningeal irritation. So the meninges is the covering of the brain and spinal cord, and these tests are done if you're trying to assess for meningitis, which is infection of the meninges. And with Kernick sign, you flex the hip and knee, and if the patient feels pain or resistance, this would be suggestive of irritation. So you flex the hip and knee. If there's pain or resistance when trying to straighten the leg, then that would suggest irritation of their meninges. So if you want to have a little memory trick, you can think like Kernick's and can't straighten knee. The K and the C, Kernick's can't straighten knee. I don't know if that will help or not. And then next is Brodzinski's sign, and that is whenever you flex the neck and it causes the hips and knees to flex automatically. This is also a red flag of meningitis. So you place your hand behind the client's head and flex their neck forward. You're watching for resistance, pain, and also looking for the flexion of the client's hips and knees in reaction to your maneuver. So their knees and hips may flex in reaction to you flexing their neck. So a little memory trick for that one is Brodzinski's bends the body. So they will like bend their body towards you flexing the neck. Next is the Babinski reflex, also known as the plantar reflex. And in this one, you would stroke the sole of the foot with something rigid. And in an adult, toes should curl down or maybe not really react too significantly. But if the toes fan up and out, that would be abnormal in an adult. In infants, they do fan out and the great toe dorsiflexes, but in an older child or an adult, they should not fan outwards. So when you see Babinski, think baby, and in a baby, this fanning out is normal and it's expected, but in a big person, it is bad. And it is also telling you that there is a problem with the brain. So a lumbar puncture, also known as a spinal tap, involves inserting a needle between the lumbar spine L3 to 4 or 4 to 5 to collect cerebrospinal fluid. For pre-procedure, sometimes, if it's a child, you might put some freezing on the area of the back where the puncture is going to be. So with like a patch with some lidocaine in it, there's EMLA patches or Amatop patches. So the things that need to be done for a lumbar puncture is, from the nursing perspective, is to assist with positioning and post-care after a lumbar puncture. A patient is supposed to try to lie flat for a number of hours to decrease the risk of a headache. Encourage fluids, monitor the site where the lumbar puncture happened. Make sure that their movement and sensation is all normal. For the positioning, as you can see here in the picture, you are going to get the patient to be side lying, usually with the knees pulled up, or sitting on the side of the bed with their body kind of curled up, like the chin to the chest and the shoulders rolled. So they're either sitting hunched forward or they are in a knee to chest position on their side. So that's another picture of a patient positioned for an LP. And again, here is a picture of the needle going into the subarachnoid space, which is where the lumbar puncture goes. So pre-procedure, you would want to make sure that informed consent was done by the healthcare provider doing the lumbar puncture. You would assist with positioning. Post-procedure, they may need to go on bed rest and encourage fluids, monitor the site, monitor movement sensation, and monitor for a headache, which can be common from any loss or leakage of the cerebral spinal fluid during the tap. That can cause very bad headaches. A CAT scan gives detailed images of the brain and can identify things like hemorrhage, tumors, strokes, or abnormal ventricles. It stands for computed tomography scan, and they are specialized radiographic procedures that produce computer-generated images with significantly more detail than an X-ray. It may be done with or without contrast. And Yeah, they're used to diagnose a number of things within the brain as well as other body parts. So before the CAT scan, you want to check for allergies if they're going to have contrast dye. You also want to consider kidney function if they're going to have contrast. And you want to educate them that the contrast can make them feel like they have a very warm sensation. It can make them feel like they're peeing themselves, even though they're not. It is a very distinct, unique sensation whenever this contrast is pushed into the IV. Post care, you want to educate the patient to encourage fluids to try to flush that dye out if they had contrast. And CAT scans are done often in emergencies. They're the first test that'll be done, like for a car accident or if someone comes in an acute emergent situation because they are quick. This is just a picture here of a CAT scan. Um, and I think we talked about all of that. The MRI, an MRI is magnetic resonance imaging. It uses magnetic energy and it gives more detailed pictures of the soft tissue compared to a CAT scan. It is used for diagnosing diseases, looking at tumors, hemorrhages, can be done with or without contrast as well. And for an MRI beforehand, we want to ensure they don't have a pacemaker or something that may um, be interfered with from the MRI. And some pacemakers are compatible with MRIs, so you'd want to be aware, you would want to check their pacemaker card. Some people can get very claustrophobic during an MRI, so they may need sedation. Um, and there's not usually a whole lot you have to do post care for an MRI. It's a picture of an MRI. Um, and then this is a picture of a CAT scan versus an MRI. So you can see that the MRI is a more clear, detailed picture of the brain over here, showing the different ventricles and just a more detailed picture, but they do take longer. So CAT scan, a way to remember this is like crash tests. So it's quick and good for like acute bleeding and accidents and stroke victims, where an MRI gives you more resolution. So it gives you better detail for diagnosing and things like that. Next is an electromyelogram, and an electromyelogram is also known as an EMG, and it involves inserting fine needles into muscles to record the electrical activity of the muscle. So instead of an ECG, which is an electrocardiogram, it's an electromyelogram. So myelo stands for muscle, and it can be uncomfortable, but usually mild, and it's used to diagnose neuromuscular disorders like multiple sclerosis, ALS, spinal cord injuries, and so think when you see EMG, electricity into muscles. Next is an electroencephalogram. So this one here is also known as an EEG, and it uses electrodes that are placed on the scalp to measure brain waves. It's often used to analyze seizure activity. So pre-care, hair should be clean and dry. They may need to stop their anticonvulsant or seizure medication for a few days before they have an EEG. And just remember that encephalo stands for brain. So this is the electricity in the brain. And this is a picture of a couple of children having an EEG done, which is measuring brain waves. And then this is the printout of the brain waves, just for your interest. So I already talked about the EEG pre and post procedure care. So just to summarize, nurses play a critical role in assessing the neurological function of the patients. We are the healthcare providers that are there 24/7 at the bedsides in all sorts of healthcare settings. Knowing your patient's baseline, getting an adequate history from either the client or their family, and early detection of changes, even subtle changes, can save lives. And for the diagnostic tests, the nurse's focus should be on safety, education, preparation, and patient teaching. So this wraps up my short review on some neurological tests and procedures. And I just want you to know the key diagnostic procedures and the key assessments for neuro. Thank you.